I do. So hello everyone and good morning. My name is Doreen Moracha. I am a HIV and AIDS advocate, a social influencer, and a young woman living with HIV, and also the founder of I Am a Beautiful Story, which is a HIV and AIDS anti-stigma. I don't know whether I can call it that, an anti-stigma uh, campaign or initiative that is meant to show people that there is a positive and a beautiful life even after HIV positive diagnosis, and that to create behavior change among people, and that they should not give up, because at the end of the day, there is nothing wrong with living with HIV. You are still a human being and a normal person like anybody else. So personally, I was born with HIV 28 years ago on 8th of August 1992, but I did not know I was living with HIV until my parents knew I was living with HIV when I was 8 years old, and myself I was told when I was 13 years old, so they had to wait. But the first time I got diagnosed, my parents were not given the hope that I would live long. They were actually told that they should prepare themselves psychologically to lose me, because there were no ARVs in my country, Kenya, and there was no hope that I would live to see my 28th year in life. So they took me home. They had me baptized. They basically prepared themselves that in case I go to be with the Lord, then I will go well enough or prepared enough. And in the year 2005, my mom became very sick. And that is actually the time she also got the courage to tell me that you're actually living with HIV, and you are going to start taking medication. So I started my ARVs in the year 2005. I've been on ARVs for 15 years now. For 2 years, though, I did not take my medication because I thought I was healed. I was going through self-stigma. So we saw somebody on TV saying he heals everything. And actually, my parents and I, we tried literally everything else to ensure that my mom and I become HIV free. But unfortunately, we have not yet, we learned to accept. But before that, we were going through a lot of self-stigma, a lot of, issues with the families. Uh, Most of our relatives never accepted us, because I remember I have a little brother who died from HIV. And when he died, my parents took me to one of my relatives who actually disinfected the utensils I was using. They disinfected my clothes. So I was literally discriminated without even knowing why I am being discriminated. And then now we are here, 28 years later. I have learned to accept my status. I have learned that there is nothing wrong with me living with HIV. I am just a guest to I am a host, sorry, to my HIV status. And I keep it in check using my ARVs. So and I would like anybody struggling with that, especially with self-stigma, there is nothing wrong with you living with HIV. You're just a human being, and life goes on. There is a beautiful life even after HIV positive diagnosis. Always remember that. And as for people who are not living with HIV, don't stigmatize people living with HIV because you feel like HIV belongs to a specific set of people. HIV is not people oriented. It is the H in HIV stands for human, which means as long as you are a human being, you are bound to get it. So remember that you should not discriminate anyone because they are living with HIV. Don't look at them in a way that they're not worthy, they're not acceptable enough. They are human, and treat them as humanly as possible. For people who are living with HIV, I know acceptance and adherence are easier said than done, but take it one step at a time. I always say that acceptance is a process. It's not an event. You don't get diagnosed and say, yay, I have accepted my status. You take one day at a time. Things get easier as days go by, but learn to accept yourself, learn to look at yourself as a normal person. And I would like to give anybody watching this and you're probably struggling with self-stigma, I'd like to give you a small exercise. Every morning you wake up and look at yourself in the mirror, tell yourself, I am greater than HIV. And believe it and own it. And trust me, things will fall into place at some point. Thank you so much.
Thank you, Doreen. Next, we'd like to go to Linus.
Okay. Hello, everyone. I am Linus Ayangwoh Embe. Uh, can I go ahead because the video is still playing?
Yes, go ahead.
Yes, I am Linus Ayangwoh Embe, the founder and CEO of Association for Community Awareness, an NGO based in Southwest Region, Buea, Cameroon. I am an advocate for health, the special focus on HIV-related stigma. I came across International Conference on Stigma way back in 2013 and 2014. I joined the organizing committee team. And since then, I've been part of the team that have been organizing this conference. I have attended the conference in 2015 and in 2017 in person. And I think I've been able to learn and impact my community with the skills that I've gathered from this conference. In my community, my organization is one of the organization that is working with people living with HIV/AIDS. And also we have been able to change so many perception from people living with HIV/AIDS. We are also trying to see how we can get across drugs and follow up for people living with HIV/AIDS. I would like to say my experience in health and especially HIV-related stigma. I've been able to learn a lot, and also I've been able to create an impact in the Southwest region, Buea of Cameroon. And I had a meeting with the regional coordinator of HIV/AIDS in the Southwest. We are looking forward to see how we can organize a stigma conference in Cameroon. And I think we are going to do that in 2021. I want to believe that with the support and the skills I've been able to gather from International Conference on Stigma, I am trying to see how I can impact a lot of people in Cameroon. In Cameroon, HIV is still something like a taboo. It's difficult for you to meet people that can disclose their status to you. And also people are still feel reluctant to do the HIV test, which is something we are trying to encourage. Like the upcoming World AIDS Day, we are going to do campaign and also testing so that we can be able to get people involved on this HIV-related stigma and see how we can assist them in the follow-up of their drugs. I would like to say in Cameroon, currently we have a very bad situation because of the ongoing conflict that is in Cameroon. So many people are living in bushes and we have internally displaced persons. And what ASQA is doing, we're trying to see how we can assist some of them that are HIV positive. We try to follow up and collect their drugs and go to the bushes and provide them with these drugs. And also we try to see how we can follow up for their treatment, because it's not easy for people living in remote area to transport themselves to where they can easily get their drugs. So we try to see how we can facilitate this patient so that they can easily take their drugs. I would also like to say that currently we have close to 58 HIV patients that are registered under our organization, and we are trying to see how we can uh, help these patients back with their normal life, because most of them are affected by HIV-related stigma. So that is what we are actually doing in Cameroon, and I would like to say I'm very happy for being part of International Conference on Stigma, because I've been able to learn a lot and also help communities, not only in Cameroon, because I am in contact with HIV patients in other countries like in Nigeria and also like in Uganda. They contact me and try to see how I can assist them, like to advise and caution them when it comes to taking their treatment. Thank you very much. I will be willing to answer to questions, and also I want to thank the panelists. Thank you.
Thank you so much. Next, Lang, if you want to go next.
Yeah, that's good. Hi everyone, my name's Lang and I am from South Africa in the Western Cape province of South Africa, and I hope my audio is good. Anyway, so I'm a research psychologist and also social behavioral scientist. And I guess on a personal note, what got me involved in HIV research is also having family members living with HIV. So I personally don't live with HIV. And then also a specific interest in different groups of the LGBTQI community. So I did a master's focusing on resilience and family resilience, and then worked at a research institution for about 6-7 years on HIV research. And that brought me to my current research, which is focused more on transgender and transfeminine individual or women, specifically in the Western Cape, South Africa. We did some in-depth interviews and qualitative code with about 8 transfeminine, and I use transfeminine because none of them identified as transgender, but are categorized within the transgender umbrella term. And I'm using information from that, or the data from that, for my PhD, which was the presentation I presented today. I think that's enough. People can ask questions if there's anything in particular they want to know. Thank you.
Wonderful. Thank you so much. Next, we'll go to Vladimir.
Hello, everyone again. First, I would like to introduce myself. And may I ask you a question? Is it possible to to share my video? Because I think that I've explained in a video my story in a more proper way that I can do it now. So if it's possible, I would be really grateful. Is it possible?
Yes, absolutely. Give me 1 second and I can go back and pull up your video. And then we'll play that and then we'll come back.
Okay, then let me introduce myself. As you know, my name is Vladimir. I'm from Russia. I'm 20 years old, openly gay and HIV activist. I'm openly with my HIV positive status, and also I'm a student of medical department of Novosibirsk State University, and local official of Standing Committee on Reproductive Health and Sexual Health. So I'm working in NGO that's called Humanitarian Project, and I fulfill my interests, which are reproductive sexual health, as I mentioned before. And I'm trying to provide equal services for men who have sex with men, and consulting for people living with HIV also. So that's me. And then I would like to share with you my personal vision of my personal experience of Stigma, and then to discuss it with you and get some questions and answer that. So yeah.
Wonderful. Thank you, Vladimir. I'm going to go to your video now and then we'll come back to the panel.
Okay.
All right, wonderful. Everybody, we are right now, your video's playing, Vladimir. So I think it's gonna run for another couple of minutes. I will let everybody know when we're gonna go back live, and then we'll go right into the Q&A. So we'll just start pulling questions out from the chat, and then if you guys wanna go ahead and answer those questions, or we'll go ahead and do that. So in about a minute or so, I'll come back and let everybody know when we're going live. Okay, everybody, we're going to be coming back to the panel in a minute, and then we can go ahead and start the Q&A. Okay, we're back. So now we'd like to go to the Q&A. So if you have questions, please put your questions in the chat section, and then our panelists will answer the questions as they come up. All right, welcome back. As I mentioned earlier, we're going to go ahead and take some questions from the audience. If you have a question, please put the question into the comment section, and our panel will answer the questions. I saw a question that came in a little bit earlier. The question was for, I guess, everyone. The question came from Harmony, and she asked, when it comes to PrEP, what does it take from someone to be prescribed PrEP in your country?
So, can I take that? Can I start?
Sure.
Okay, so in my country, in Kenya, for you to get PrEP, you first have to get tested to confirm that you indeed not living with HIV. And then after that, they now want to find out about your partner. Sometimes your partner gets called in, or you might be, at that particular moment, you might be together. And then after that, now you're put on PrEP, and you start immediately. In government hospitals, it's free. In private hospitals, I am not sure if they charge, but I think there has to be like probably a charge. But for government hospitals, it's very free. It's a little bit cumbersome because you have to explain why you need PrEP, what is making you feel like you need PrEP and all that. But it is accessible and it's free in Kenya.
Thank you, Doreen. Does anybody else want to respond to that question?
Could you repeat the question? Because I've heard something about PrEP and access for PrEP. Is that right?
That's correct. The question was, what is required to be prescribed PrEP in your country?
Oh, okay. I can explain how does it work in Russia. So, in fact, it is absolutely unable to get PrEP in Russia, only in two cities such as Moscow and St. Petersburg, which are the biggest cities. You can find infectious doctor who can prescribe you a PrEP and consult you with this. But here in Novosibirsk, which is third populated city in Russia, there is no any specialist that could prescribe you a PrEP. So even of those who know about PrEP, they can get it only with you know internet sites and something like that, and it is semi-illegal, and nobody just is able to control and to explain how does it work, that you have to check up you know to do checkups for your sexual health, and you take the PrEP. And this fact, this fact is one of the reasons that makes the situation with HIV is really problematic. So that's all. Thank you.
Thank you, Vladimir. We're just waiting for some more questions to come across.
Excuse me, I have a question. Actually, I have not seen my video here, so have you shown it via Zoom or via another platform? How does it work?
Yes,
Because I haven't seen
yes,
it.
your video was just playing on the live stream, and so they just watched it. So if you want to speak to that,
Ah, okay. Okay, got it.
Am I allowed to ask a question to my fellow panelists?
absolutely.
So I want to ask, for Vladimir, for Ling, and Linus, how is the stigma context in your specific countries? Because currently, like in Kenya, we have the major problem we have with the dealing with HIV is the stigma, because people think if you're living with HIV, you have to look a particular way. You have to be thin and look like you have to die the next day and all that. But when you tell them that I have lived with HIV for this long, they're like, no, there is something you're lying about. So how is the stigma context, or how is the HIV perceived in your specific countries?
Yes. Can I answer?
Yeah, please go ahead. It's a question for all of you.
Okay. Actually, looking at the stigma content in Cameroon is still a taboo, like how so many people consider. Like I mentioned before, there is still a lot we need a lot of sensitization on HIV related stigma. So it's kind of still difficult here in Cameroon to like meet someone and the person will like, hey, I'm HIV positive and I'm okay and things are going well. So that is the more reason we focus more on stigma, try to see how we can eradicate stigma to persons. So it's really difficult here in Cameroon, and mind you, we always do research. You still have some people that believe that there is nothing like HIV like HIV here in Cameroon, and there are still people who don't even have idea on what is HIV. Mostly people in rural community. So it's still kind of in Cameroon. We still need a lot of awareness on HIV related stigma. That is the more reason I had a discussion with the regional coordinator of Southwest region, and he proposed that there is a need for more stigma events and more stigma campaign in Cameroon. So it's kind of is still something that needs to be done seriously in my community.
Thank you so much, Linus. Lane, do you want to answer?
Yeah. I'll speak to that. That's quite an important question because I think thinking around Africa, how the disease differs and spreads, it's spread according to different demographic profiles. It's quite unique. And South Africa is quite interesting. We have the largest population of people living with HIV in the world. My most recent statistics still serve me. And so I guess what's happened, and there's been a long journey of the government, not making ARVs available, and then it was made available, and there was a lot of advocacy for ARVs. And so it's kind of reached a point where people have become used to it. And then through that, there's like a perpetuation of further stigma. And interestingly enough, whereas in the rest of the world, you'll have more in the European and North Americas, maybe LGBT different groups like MSM and transgender drug users that are higher at risk. In South Africa, it's still the larger population. I mean, 1 in 10 people in South Africa are living with HIV. And I think it's 1 in 5 women or something like that are living with, I mean, again, it might be slightly varied to what I'm saying now, but yeah, so mainly young women are at risk. So there's for me, a big, it's a heterosexual disease more than anything. I mean, there's clearly a stigma against key populations, but then there's also a lot of gender differences. So there's hegemonic masculinity obviously plays a big role. A lot of men test by default to their partners, and there's a lot of violence and a lot of abuse still from men towards women, so it makes it really difficult to navigate the larger population of women living with HIV, and it's young Black women mainly. So that's kind of like the space people are living with in South Africa. We've been normalized, but we're still falling back. People, instead of keeping up the knowledge and awareness of HIV, they've kind of become so used to it that and it's so easy accessible to test and to get ARV treatment that there's like a resurgence of some forms of stigma, and I think women carry the biggest brunt of that, unfortunately.
Yeah, I understand. It's literally the same situation here in Kenya. We think we are moving forward, but when the statistics come out, we are not doing good at all. So Vladimir, can you give your input on Russia and how is the stigma being taken in your country?
Yeah, I can. So telling about regional context of stigma in Russia, the third thing is really important to mention is that stigma is hardly double rate on men who have sex with men. I mean, HIV positive men who have sex with men due to federal policies, which are totally prohibited to be gay in Russia. And even if you got gonorrhea, when you just contact with your general practitioner or dermatologist or a SRHR consultant, he will totally judge you because you are gay, and that's all. And there's no any friendly services for gay populations. There are friendly services actually for people who use drugs, but there is still no MCT, methadone. How to say that in a proper way? You know what I mean, yeah. Yeah. So the injectious way of transmitting HIV was the first one for a very long time in Russia. And there is still no place for MTT, and it just makes um, people who use drugs dying of HIV or of their addiction. Um, it makes the situation really harder. And then, as I mentioned before, there's a large stigma on men who have sex with men. It is really hard to get PrEP. It is absolutely impossible to get post-exposure prophylaxis, and it is a hard way also to get treatment when you got HIV positive status, because as I mentioned in my video, um, it is still it remains to be the first main source of stigma. Uh, the doctors and MDs or whatever, different kinds of medical workers remains to be the first um, source of stigma. So when you are gay, when you are HIV positive, and when you come to your infectious doctor, he can judge you for being HIV positive, for being gay, and it really sucks. I'm sorry, but um, I'm a lucky one who have never experienced it, but many of my friends have experienced it, and uh, that's why we have a really bad situation, and moving forward is really hard to, yeah.
Oh my God. Clearly, we still have a long way to go when it comes to fighting HIV and its stigma. And the situation in Russia actually just saddens me a lot. And
Yeah.
yeah, it's very sad because the first place you expect to find as a safe space, which is the healthcare, from the healthcare provider, from the healthcare setup, is now also an avenue for stigmatizing you. So we really do have a long way to go, and I hope that this forum opens up that conversation, and probably by the time we are meeting in 2021 for the 12th International Conference of Stigma, then maybe things will have moved a little bit better. So yeah,
Yeah, I hope so too. Yeah.
let us pray so.
We have a question from the audience, or actually a couple questions from the audience that I wanted to put to the panel. The next question was from Marie. She asked, "What has been your main support there in Russia, and what can the international community do to support you?"
Uh, I actually skipped the first part of question. Could you repeat it?
Sure, I'm sorry. Marie asked, "What has been your main support there in Russia, and what can the international community do to support you?"
Oh, well, um, um, uh, as for me, the international community can be involved. Actually, the international community is already involved, such a like Elton John AIDS Foundation is involved in Project Positive Strategies, which allow our organization to provide services for men who have sex with men, and um, well, um, involving more financials from global fund could be really useful too, because for now, the amount of money that um, comes from federal budget for prevention needs is not enough. It is absolutely not enough, and that's why you have no ability to get PrEP in Russia, even for even by your own, because You can find it in pharmacies. You can find it anywhere. So yeah. Have I answered this question, or I have something to add? I don't know.
Well, thank you, Vladimir. We have another question from the audience. This question is from Donald, and he asks, how is the pandemic impacting HIV services in your country? And I guess this one is for the entire panel.
So, can I start? Can I start?
Absolutely.
Yeah. Can I ask
So,
something before you start, Doreen?
Okay.
It's not to start. I'm just curious. Is Donald referring to the pandemic, the HIV pandemic, or is he also referring to possibly COVID? Just for clarity, I wasn't sure if he was referring just to HIV.
I was thinking it's COVID because the question is, how is the pandemic impacting HIV services in your country? So I am thinking it is COVID.
Yeah,
I
agree.
You think it's COVID because I was going to actually reply on the COVID perspective. So if we are talking about COVID, COVID-19, I feel that COVID-19 has actually taken us a few steps back when it comes to how far we had actually come when it's involved with the accessing of HIV services, because we were at a point where you'll get clients who will go for up to 6 months on medication and they're not coming to hospital, clients who are adhering to the medication, clients who are very virally suppressed, and things were going well until COVID hit. Now, some of these people have had to go through loss of incomes. Some of them have had to relocate from the city and go back to the rural areas. And with all these shifts happening, some of them have defaulted. In fact, right now we have a crisis of defaulters across all facilities. And when these people come back to hospital, they explain to you, and you actually can't really blame them for defaulting from the ARVs because they had to relocate. They had to shift a little bit about their life. We are now having people who are going to bed hungry because they don't have food, they don't have a livelihood, and you're looking at taking ARVs. Taking ARVs on an empty stomach is a very tough calling, very tough. You can't, because the medication itself is very strong on the body. So on an empty stomach, it's a different kind of pain that I cannot explain. So people have gone to bed hungry. And they were not it's not that they want to, it's just that the pandemic happened, they lost their incomes. And these are probably people who are living from hand to mouth every day. They go for a casual job, they get money, they buy their own food. And then we currently have a stock out of septin medication and a little bit of nevirapine septin for children. So when the septin medication disappeared from the hospitals, people were forced to buy. You're forcing people to buy medication in the middle of a pandemic when they are trying so much to hold on to the little money that they have. So this person will choose, do I buy Septrin or do I buy food? And definitely they're going to buy food. And a lot of them have been worried because I do my advocacy largely on social media. So I get these questions every day. People asking me, Doreen, can I take Septrin? Can I take my ARVs without Septrin? Because I'm not in a position to buy the Septrin medication. And when the chemists, the pharmacists realized that there is a gap, there is no Septrin medication in public hospitals, they basically hiked the price. So maybe something that was going for like I don't know how to put 10 shillings in dollars, but it was very, very cheap. But now it's super expensive because it's not there. It's not available. So the pandemic has actually affected how people are getting medication. It has affected how people are accessing their clinics. And it has actually made some people are not able to go to hospitals. Some people, when the first time the pandemic hit, there was this saying of stay home, stay safe. But to a lot of people living with HIV who have not disclosed their status to their family, who have not made the HIV status known, those people struggled a lot because these people are living in a household that has people who are probably misinformed about HIV, don't know that there is somebody living with HIV in the midst, and they're making all these mean jokes. And for some reason, COVID kept being referred or intertwined to HIV. So you feel uncomfortable in your own house. So home is no longer safe for you. It's not a safe space for you. But what do? You have to stay there. So some people even opt not to take the medication because somebody will see me taking medication every day and question what is that medication for, and I can't do it. So to me, it has affected and it has taken us some steps backward. I don't know how we're going to come to where we were, but let's hope for the best. That's all. Thank you.
If you don't mind, I can answer this question too. So, do you mind?
No, go ahead. It's a question for all of us, by the way.
Okay. So before the COVID times, we had mobile points of testing called test mobiles. These points were for key populations such as people who use drugs, men who have sex with men, and sex workers. So during the COVID restriction, when Just Mobiles had cancelled temporary humanitarian project, the organization I'm working have has organized delivery for self-testing tools with prevention tools also, like condoms, lubes, pharmacy certificates for sterile syringes, and something like that. And also organized remote SRHR consulting for the clients via Zoom, WhatsApp, or something else. Um, During our work, we're trying to support people living with HIV and make them to start antiretroviral therapy as soon as possible. So we have organized delivery of ARTs for those who are unable to take it on their own from from the AIDS treatment center. And well, unfortunately, COVID affected us negatively. So it's obvious. Unfortunately, we can consider that patients are able to get ARVs for several months, like it happened in many regions, multi-month refills for ARVs. So there were some problems because many of resources have been redirected to COVID, and that's why for some treatment schemes was only 1 month refill, or just infectious doctors had to change the treatment totally to different sets of ARVs. And what else? To sum it up, I can say that COVID totally affected us, but it is also a positive experience because we've discovered a lot of ways to work more effectively, a lot of works to a lot of ways to work remotely, and we really truly hope that this great experience and algorithm of remote supports of people living with HIV and K populations will be saved and successfully used for further work. But in fact, there were some problems for redirecting to COVID, and we hope that the situation will change as soon as possible. Because for now, many of people living with HIV in my region are unable even to get their viral load results or something else because the laboratories are very busy with COVID tests and something like that. And actually, I would like to add something for previous question that was asked to me, I told about involving greater global fund financing, and I told about prevention too. So I told about there are no any access to PrEP, but I can also add that there are no any access to combined ART schemes because of the same reason. Well, I'm an activist, and I have a lot of friends and colleagues in AIDS treatment center, but I still have to take 4 pills a day because there are no any combined schemes such as Eviplira or Ginvoya or something like that. And the only city that I can get it is Moscow, but I um, can get it if I buy it because for free I have to take 4 pills a day, and that's the reason uh, why why the Russian NGOs and Russian ministries of health, something like that, should be more involved in international work because uh, it really affected HIV positive people. Yeah, yeah, that's all. I'm very sorry for delaying you because I really realized that I have to share these very important thoughts on previous question. Very sorry.
Okay. Can I add something? Hello?
Yeah, we can hear you. You can go.
Okay. I just want to share a little bit experience concerning COVID and the HIV in my community. Actually, the COVID really creates a lot of negative impact when it comes to HIV in my community, for the fact that many organizations focus on the COVID, forget about the HIV, and so it was really difficult to maybe work on the HIV because to assess these persons living with HIV positive, it was kind of difficult because all the attention was on COVID. And also some of the people living in rural community, it was kind of difficult for them to a unit whereby this unit can focus on HIV related persons, and also another unit for especially for COVID-19. And kind of is a good thing that concerning the COVID in Cameroon, it is not really as we were expecting. In my community, I don't think we have had up to 100 confirmed cases, like in southwest region of Cameroon. So the life over here is kind of a little bit normal back, but the people living with HIV during the COVID, like the first month and the second month of COVID, it was really difficult for people living with HIV and for civil society organization to work with people living with HIV/AIDS. Thank you.
Cool. Thanks, Linus and Vladimir and Doreen. I'll just do a quick response to that. I think it's quite a difficult still to see the effects of COVID and the impacts of it on HIV. I think on lived experiences, so someone living within a community, it's obviously been most intense. But like a larger scale look at it, population-wise, it should be very interesting. And I know that the AIDS conference this year also spoke about it. there's some recent just a report that one of our provinces had about 19, it's almost 20% reduction in HIV medical collection since the introduction of lockdown. So South Africa went through a period of strict lockdown. And so clearly there's effects, and possibly one of the bigger effects is due to the connection, well, HIV being related to social determinants. So obviously in lower socioeconomic spaces and resource rich areas, people face most risk. Obviously, during that lockdown period in South Africa, a lot of people weren't working, a lot of people lost their jobs, a lot of companies were affected. So it's kind of scary. I think it will have long-term effects within the next, which we'll only see in the next year to 2 to 3, even longer. And so maybe in a country like America with a stronger GDP and an economic setup, it's probably easier to bounce back, but this is probably kicking South Africa and the economic setup back about 5 to 10 years. And clear effects then on HIV, and also connection to TB, which is HIV is a major driver for the TB epidemic as well. So now you not only have people that are at risk for other illnesses like TB, but also then COVID as well. So it's just this interesting effect that it's had. But yeah, there's also been recent kind of refocus in the government to make sure that people get funding and aiding in South Africa as well. But yeah, definitely it's going to have quite adverse effects, and it already is showing. So yeah, that's just for me to add.
Wonderful, thank you. Are there any additional questions from our audience? Well, I don't see any additional questions coming from the audience, so I'd like to thank the panel. It's been wonderful having you this morning to share your stories. We're going to continue with the international session. We have a couple of videos, and then we'll head in to an intermission, which will be followed by lunch. But once again, thank you for taking time out. I know it's different times around the world, so thank you, whatever time zone you're in, for joining us this morning for this really exciting panel. Thanks again.
Yes, I can see one more question from
One more question.
Dr. Rena. He said he has one question. I don't know if it's for us.
For Dr. Rena, we'll keep it open. Let's see what he has to say.
Okay.
All right, Dr. Rana's question is, how can we work together throughout the year rather than just once a year?
Can I respond to that?
Absolutely.
Yes, thank you very much, Dr. Rena, for that question. I think we have already been working together what we need to do now is to expand the scope of our work. I also have this proposal for the International Conference of Stigma. I think if we can make it rotationally, like not only in US, I think it's high time we reach out to many communities. Maybe we can change the strategy whereby we do this conference and also go to other countries like in Russia, like in Kenya, like in UK, and organize a conference there. And also, since some of us are part of this initiative, we can also stay back in our own local community with the support of international community. And we organize events like workshop on HIV-related stigma. And we at the end of the report, at the end of the project or the workshop, we can send the report to International Conference on Stigma so that they can project this activity to the international community. So I think if we can build a serious network, we can do more activities when it comes to HIV-related stigma in our own in our community and with the support of international community. Thank you.
Personally, I think because we know that one, I believe that we can end HIV new infections, we can end the stigma, but we need to normalize the conversation because there is something about us waiting for conferences, for World AIDS Day, and then we can start talking about HIV. But people living with HIV are actually living with HIV throughout the years. From January 1st to that December 1st, they're living with HIV, they're struggling every day. So we need to normalize this conversation in the different countries, in the different networks, strengthen, if we have to do workshops, if we have to make a better, to push the local countries to make better communication materials that HIV is there, but it's no longer a death sentence because a lot of people, and what is actually making the stigma even become more is the fact that people believe HIV is a death sentence. And we addressed literally almost, we have addressed a lot of issues in HIV related services. We have given people medication, we've given people proper healthcare services, we have come up with better prevention methods, but we have left out the conversation part. So a person goes to hospital, picks the medication and behaves like they did not even show up in that hospital. And that is what we want to try and break loose. Let these people know that there are over 38 million people living with HIV in the world, and it's not just them. And we had support groups in our country. I don't know why they kind of stopped working, because when the support groups were there, people had better, like you could get people who, patients who are very motivated to take the medication, to accept themselves, because they will feel, I'm in a group of 10 people that we are all living with HIV, we are all going through one struggle or another, we are all taking time to accept, we're all taking time to disclose, we're all disclosing, or this happened to me during my disclosure. But nowadays it's not like that. It's you for yourself, God for us all. So how we can work together throughout the years. In my country, I would suggest that if we would actually strengthen the support groups in various facilities. Just make sure that they're strong, make sure that they're working, make sure that they, at least these people have a way of interacting with each other instead of going to hospital and taking medication and just going home like nothing ever happened. Thank you, that was all.
Well, I'd like to thank our panel again. And now we will move on to the next portion of the international session. Thank you again, panel, and have a wonderful rest of your day.
You too. Bye.
Thank you.
Thank you.
Thank you, and bye to all. Thank you very much.
Bye. Thank you.
Bye.